Hi, guys. Welcome back for our daily practice questions. It is day 72. And as always, y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder. You know that we know there's no absolutes. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. But with that being said, let's get into question number one for today. And for those of you who are looking to join the upcoming 5 week intensive review course that starts April the 21st and runs through May 30th, I have 2 spots remaining. So if you're looking to join, click the link in the description. All right, you guys, question number one. A 38-year-old male presents with symptoms of dyspepsia, including epigastric discomfort, nausea, and bloating. After testing positive for H. pylori infection via a urea breath test, the nurse practitioner prescribes the following regimen for the H. pylori eradication: a PPI, clarithromycin, and amoxicillin. What is the most appropriate course of action based on this regimen? Is it A, this is the correct first line treatment for H. pylori eradication? B, this is not an appropriate treatment for H. pylori infection? C, this regimen should be continued for 28 days? Or D, this regimen should be used only in patients who have failed previous treatments? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, what is the most appropriate course of action based on this regimen? Now, y'all, same thing I tell you with a treatment question. Just because it says most appropriate course of action, next best steps, etc., we're still talking treatment. So just as I tell you with any other treatment question, you need to run it back and see if they provided you with a diagnosis, if they're asking you for the most appropriate course of action based on this regimen, there has to be something already in place, right? So run it back, look at those things, and follow through, okay? Don't change just because the wording has changed. But what are we doing here? We're treating H. pylori, we're doing an H. pylori infection eradication, right? And we're following the regimen of a PPI, clarithromycin, and amoxicillin. And the best answer is A, this is the correct first line treatment, right? Because this is just simply triple therapy. You can use triple therapy, you can use quadruple therapy, but there's no reason not to use triple therapy. The only time we would not use it is if they have like resistance to it or allergies to specific things, etc. Right? And I'll go into that a little bit more, but let's go through some other questions. So I'm not giving you the answers to the next questions. But if there's no reason to not take the triple therapy, it is one of the first line therapy options for H. pylori eradication. Okay. Question number two. A 50-year-old woman with a history of H. pylori infection presents with persistent dyspeptic symptoms despite completing the standard triple therapy regimen, the PPI, the clarithromycin, and amoxicillin 6 weeks ago. Her symptoms have not improved, and a follow-up urea breath test remains positive for H. pylori. Considering antibiotic resistance, what is the next step in treatment? Is it A, start another 14-day course of triple therapy? Is it B, administer quadruple therapy, including a PPI, bismuth, metronidazole, and tetracycline? Is it C, prescribe a long-term PPI for symptom control? Or is it D, perform an endoscopy to confirm eradication and examine for complications? Take a moment and tell me what you got in the comments, y'all. Tell me what you think. All right, so stem of the question here. Considering antibiotic resistance, what is the next step in treatment? All right, same thing. So what's our next step? So what are we already doing? So we have this patient has H. pylori. We already did the triple therapy regimen with our clarithromycin, amoxicillin, PPI 6 weeks ago. Symptoms not improved, and she's still testing positive, right? So now you're going to want to go with the quad therapy. Because if we're seeing signs of any resistance or anything, or a lack of improvement in therapy, go quad therapy. There's no need to do triple therapy for another 14 days. Go to the quadruple therapy. So B is your best answer. And then question number 3. A 45-year-old male patient presents with a history of peptic ulcer disease. His recent H. pylori testing confirms active infection. He has no history of failed treatments, and local antibiotic resistant patterns are not concerning. The nurse practitioner prescribes triple therapy for H. pylori eradication. After completing the therapy, what is the best way to confirm the eradication of H. pylori? Is it A, to perform a stool antigen test or a urea breath test at least 4 weeks after completing therapy? Is it B, or order serologic testing immediately after completing treatment? Is it C, retest for H. pylori at 1 week after completing treatment? Or D, repeat endoscopy to confirm the absence of H. pylori? So again, A, will we perform a stool antigen test or urea breath test at least 4 weeks after completing therapy? Is it B, will we order serologic testing immediately after completing treatment? Is it C, would we retest for H. pylori at 1 week after completing treatment? Or is it D, will we repeat endoscopy to confirm the absence of H. pylori? Take a moment and tell me what you got, y'all. All right, so stem of the question here. After completing the therapy, what is the best way to confirm the eradication of H. pylori? All right, so once we have done any type of treatment, triple therapy, quad therapy, what is the best way that we go about to make sure that we have actually eradicated the H. pylori infection? And the best thing is A, you want to perform either a stool antigen test or a urea breath test. And you want to wait 4 weeks after completing the therapy. Also, during that 4 weeks, for 2 weeks, you want to make sure that they haven't been on a PPI. So you can do like a H2 blocker um, to cover them, or like antacids during that 2 week period to help with symptomatic management, but you do not want to have them on a PPI within 2 weeks before testing. So 4 weeks after therapy is completed, and they need to be off of a PPI for 2 weeks before you retest and check for the H. pylori eradication. Okay. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. Thank y'all for all of y'all who have been sharing and referring. I see the subscriptions and I've been getting the emails from people. I do appreciate y'all. Um, as I continue to try to reach more people and help more people, it helps me as well when y'all are sharing. So I do appreciate y'all. Thank you, thank you, thank you. And if you need any other things that I do offer, as always, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions, any of my question analysis sessions, any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.